be respectful of your time. I'm Dr. Erin King-Mullins. I am a double board certified colon and rectal surgeon, and we are going to move forward and start with the program. First, I think we're going to have a message from our Medtronic team.
Thank you everyone for joining. I would like to introduce Dr. Erin King-Mullins, who is a double board certified colorectal surgeon and founder and owner of Colorectal Wellness Center in Fayetteville, Georgia. She has been practicing for more than 12 years and is known for providing compassionate, advanced colorectal care with a strong focus on dignity, education, and quality of life. Dr. King-Mullins earned her medical degree from Emory University School of Medicine in Atlanta, completed her general surgery residency at Orlando Regional Medical Center, and went on to complete fellowship training in colorectal surgery at Georgia Colon and Rectal Surgical Associates, where she later served as faculty and research director for her fellowship program. In addition to her clinical practice, Dr. King-Mullins is a national leader in colorectal surgery. She currently serves as president of the Society of Black Colon and Rectal Surgeons and as a counselor for the American Board of Surgery. Her professional interests include women's colorectal and pelvic health, colon cancer screening, health equity, surgical nutrition, and improving access to specialized colorectal care. Dr. King-Mullins is also the creator of Tushy Touch-Up, a personalized anal restoration and rejuvenation procedure designed to support function, comfort, hygiene, confidence, and aesthetic concerns based on each patient's individual needs. Today, she brings her expertise and patient-centered approach to an important conversation about fecal incontinence, bowel control, and treatment options that may help patients improve their quality of life.
Thank you so much for that warm introduction. I'll send the check in the mail later. Just kidding. No, everyone, thank you so much for joining us this evening. This is a very important topic, and I'm really excited to be able to bring this to you in, an anonymous fashion. This is a subject matter that a lot of people have difficulty coming forward and speaking about. And, wherever you are in life, you probably interact with someone every single day who is also suffering from this. And so I want to give you the confidence to be able to understand that you're not alone, and that you can share this with others and especially your providers. So there's some questions that are on the screen. Will I ever regain control? Attend an outdoor celebration? Do you feel afraid to leave your home? You always feel like the bathroom is on your mind. Like you have to know where every restroom is, no matter where you go on your path to work. Are you having difficulties getting a job or going on a date because of, your concerns about lack of bowel control? Well, it's time for a change. 54% of patients or people that are suffering from fecal incontinence have never even discussed it with a doctor. But bowel issues are not inevitable. It's not just, oh, it's a part of life or, oh, it's aging. So if any of these sound familiar to you, involuntary loss of stool, staining underpants, stool present every time you urinate, if you're having to use pads or protective garments, or you find yourself planning activities around the restroom, your body is trying to tell you something, and I need you to listen and answer it. Oops, sorry, jumped ahead a little bit there. Okay, so you're not alone. Incontinence affects people of all ages. It affects both men and women. And so studies have shown that living with fecal incontinence can cause other serious problems: embarrassment, depression, lower quality of life. So right now, it is estimated that bowel control problems actually affect about 1 in 12 US individuals, the adults. That's 21.4 million adults. So let's talk about how bowel control works. It's a very complex system, and so it takes coordination between the bowel and the brain and the anal sphincter complex down near the rectum. And this is essential for bowel control. And so breakdowns in any parts of this pathway can lead to problems with control. So as the digestive system, as you see on this diagram here, it's a continual loop, right? So you have nerves that are signaling your brain to relax the sphincter muscles. That's in response to you eating and your digestive system pushing the food and the waste forward. Once that food, that waste reaches the rectal area, the nerves in the area are stimulated, which goes back to the brain. That's what signals the brain to tell the sphincter muscles to relax and open. So, again, disruption anywhere along this path can cause bowel problems. So there's great news. There are treatments that can give you back to living, your life. Now, I'm not going to say it's going to get you back to living your normal life because not all treatments are perfect. Not all treatments will get you to 100%. But again, our focus is on regaining that quality of life, minimizing that anxiety and that embarrassment. So there are conservative treatments and there are more advanced therapies. Now, the diagram we just demonstrated is a very simplistic model, and we'll talk about, there are other causes outside of just having that pathway, but that's just kind of the basis of the conversation that we're going to have this evening. So, when we talk about conservative treatments, before we dive into that, let's talk about some of the other impacts of or causes of incontinence besides that kind of neural or nerve pathway. Because these conservative treatments can help some people, but may not work with everyone, or these treatments may need to be additive or utilized in addition to some of the more advanced treatments. So, dietary modification, think about it, the basis of if your bowels, the consistency, the texture of your bowels are abnormal, you may need to change your diet. You know, think about it. It's easier to hold a rock than mud than water, right? And so if you're having constant diarrhea, it may be difficult to control those bowels. And so bulking things with fiber, changing your diet, maybe figuring out if there's any digestive issues or food sensitivities, that's dietary modification that may help by just simply changing the texture of the bowel. Physical therapy, there are muscles, the sphincter muscles. There's a whole complex of muscles down there that are very smart, by the way, that indicate based upon those signals from the brain when it's time to squeeze, when it's time to relax. Some of those are involuntary and some of those are voluntary, right? You are used to traditionally when things were normal, when you had the urge to use the restroom and you needed to hold it, you could clench down and squeeze. And so if there's any discoordination of those muscles, whether it be because you've had surgery before or bearing, carrying, delivering children, the discoordination of those muscles or the movement of those muscles sometimes requires physical therapy. Bowel retraining after you've had trauma or surgery or deliveries in that area. Sometimes the coordination of you just knowing. So I'll give a perfect example in my office. Patients will come in and they say, I have difficulty evacuating. I feel like I'm squeezing, 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 and nothing's really coming out, right? And again, this is not necessarily related to incontinence, but just kind of a global picture of the complexity of the pelvic floor. So a woman or a patient, whomever may complain that they're pushing and they just don't feel like they're evacuating. And so on basic examination, via rectal exam, if I ask someone to bear down, to push like they're trying to have a bowel movement, sometimes they're literally bearing down with their stomach and their diaphragm. And those pelvic muscles aren't really moving at all. And so that's an example on how bowel retraining can come into play, that biofeedback, understanding the make sure that you're using those right muscle groups. And then medications. Again, if someone's having issues with diarrhea, sometimes medications may have to be prescribed to slow the bowels down and the like. So those are just some examples of conservative treatments. So now let's move on to advanced therapies, right? The reason why I have a job. So if those conservative treatments don't work, or they just don't get you where you need to be, Sometimes there are more advanced therapies that can kind of get you over the hump to that level of satisfaction, to that level of quality of life. So you can go on that vacation, go on that road trip, go to work and not feel embarrassed. So the Medtronic company offers the InterStim systems, which we'll get into a little bit more later. And there are some other surgical options because, again, while we discussed very simplistically that whole complex of how the nerves and the stomach and the sphincter muscles tie together, there are other areas of derangements that may impact your bowel function that may require other additive treatments outside of those conservative therapies. So the various surgical options, they aim to, so some of them aim to literally physically repair the anal sphincter muscles. So if there's been any major trauma or injury to the area, so during childbirth or any prior surgeries, then sometimes just simply a surgical or anatomic repair, just fixing those muscles like they're supposed to be, um, that may have to happen. And so sometimes that's just repairing the muscle itself, bringing the edges back together. A sphincteroplasty is reconstruction by kind of overlapping those sphincter muscles to give that integrity back. And sometimes advanced surgical options are not necessarily dedicated to fixing the problem, but rather bypassing the problem. And that's when sometimes a colostomy or an ileostomy comes into play. The ostomy is when a opening from the bowel is created against the abdominal wall and your waste is passed into a bag. Those are options for some patients when some of the other advanced options are not available or there's some complex diseases in the area that impact or bypass just any other operative technique. And while no one wants to have an ostomy, if our focus is on quality of life and control, you can control when it's time to empty that bag, dispel of that waste. Similar to, your normal anatomy, when things are normal, when you get the urge to use the restroom, you can defer. You can say, wait, not home yet. So I'll wait till I go and go in the restroom and pass the waste. Well, if you're beyond any other conservative or surgical options at repair or restoring things to use the restroom like you normally would, then the ostomy bag, again, at least gives you control and the ability to decide when to dispel your waste as opposed to just things passing whenever and wherever, which we all know that's not fun and why we're here this evening. So let's talk about one of the most advanced therapies that we have right now. We're going through a lot, so please, if you have some questions, go ahead and start putting those in the chat, writing them down. We'll try to get to as many of them as we can. So sacral neuromodulation, the Medtronic InterStim system, is a system that I use pretty routinely in practice. And the basis of this goes back to that diagram that we were kind of comparing before, that neural pathway to kind of stimulate the sphincter muscles how to function appropriately. And so the sacral nerve stimulation helps redirect or retrain any miscommunication that there may be between the brain and the bowel, which can help restore that bowel function. So the InterStim therapy has been demonstrated to improve fecal incontinence symptoms for a long period of time, long term. So there are different options. And so on the screen here on the right, you see a little device, basically a battery pack, and there's a little wire that's kind of snaking away from there. And so that is the full device that gets placed during the procedure. And on the right, you see the depiction of someone kind of on the back, and you see where the device is kind of seated just beneath the skin. Very similar to if you know anyone who's ever had like a pacemaker or a port for chemotherapy. So something that rests under the skin, it's not exposed externally. And then the wires feed into the sacrum in certain areas where the nerve input to those sphincter muscles fire and trigger it to kind of help that communication from the brain to those sphincter muscles. So there's two different options. There's a recharge-free device and a rechargeable device. And so the decision between which to utilize should be individualized between you and the doctor based upon your lifestyle and your goals. Um, so you can get up to 10 years of battery life and therapy at low energy settings. There's been some documentation that the device can last for up to 15 years before discussing the need to interchange or change out to a new battery. So the technology is getting more and more facile and longer lasting now. And the InterStim Smart Programmer allows you to manage therapy. There's different program settings and different strengths of energy that you tailor to your own needs, and obviously, the goal is to utilize the lowest settings that are necessary to start with that. But there are a lot of variation in the different programs and options that you have for your lifestyle. The good news is also, once you get to your optimal therapy, it really should be a set it and forget it. Now, there are different reasons that changes may have to happen. We can get into that a little bit later. Success is defined as at least having a 50% or more improvement or reduction in your symptoms. But again, this can be additive. Maybe you started out with conservative therapy, changing the bowels, getting pelvic floor rehab therapy, and you got about a 25% improvement there. And now we're moving on to advanced techniques. Based upon that baseline, if you get at least another 50% improvement in that, we're, at 75-ish% improvement in your overall symptoms. So again, some of this can be additive. So for most patients, it takes an evaluation and about less than 1 week to really experience the results. I've had patients experience a difference in their results or understand that it may work for them in as little as 3 to 4 days. So, get ready. The tests start at the office or at an outpatient center. That's how we get ready for the procedure. And so we start out with a testing phase first before we subject someone to having a permanent device implanted. If we don't know it's going to work, there's a testing phase first. So, um, for appropriate candidates, it can simply be tested in the office. A small wire is inserted in the upper part of the buttock area and it's attached to a small external device. That's what delivers the therapy. And so to test the therapy, there's certain settings and changes that happen, and there's a whole team of individuals that are participating in this to get your feedback to understand what your symptom improvement is or any discomfort you may be feeling. And so you have a programmer, looks like a little smartphone, and that's how you adjust your settings and your programs to kind of get to your sweet spot, to your Goldilocks area. Um, and then you resume your regular activities for the next several days. Um, at a follow up evaluation, either in office or via phone with the team, we'll start asking you about those results. Are you getting what level of improvement are you getting? What sensations are you having? And then we figure out if we need to fine tune anything. Um, Again, always important to note that because it's a procedure, there are some complications that can happen related to um, the movements of the wires, some technical problems, temporary pain, bleeding, very, very minimal risk of infection. Again, no procedure is with zero risk, but there's regular communications to ensure and comfort you along the way. So you can be confident that you can get an MRI with this device. Some of the initial generations of the device was not MRI compatible, but the Medtronic Scan systems are available to streamline during MRI testing. It's the only sacral neuromodulation system that currently has this technology, and so it's capable with full body scans. You don't have to necessarily do any specific testing prior to an MRI scan. And it's a MRI mode that is available on the kind of smartphone appearing device. And so you can activate or deactivate the device during that time. And so all the Medtronic InterStim systems with SureScan have the same MRI conditions. So they're going to be compatible across all systems. Okay. And then there's an app, as they say, there's an app for that always. Excuse me, but the My Future app is with you throughout the journey. And so it'll allow you to find, immediate information, personalized information to kind of help make informed decisions along your journey. And so traditionally, again, to document that you've had at least a 50% improvement in your symptoms, we don't just ask you to memorize that. While most people are pretty attuned with what their symptoms are and how frequently they have these incidents, we won't hold you to it. And so with the app, there is a diary that's available where you can keep track of any incidents that you may have. So during that temporary phase, you can really get an objective measure of if you are getting improvement. And so, and then there's some walkthrough videos and other educational content that can help find personalized answers for you. So if you're watching online now, you can actually, if you're interested in just playing around with it and learning more information, you can scan the QR code on the screen and download this app just to start playing around with it for any additional educational content. Or if you want to get, ahead of the game and get a jump start on that diary, now you can do so. So you can, if you decide to come see me, you can come in prepared. You're like, this is what my diary, this is what my bowels look like. And I'm like, all right, let's go. Let's figure out what we're going to do to help you. So is this therapy right for you? You may be a good candidate and you might not be. And so there's careful guidance for us to help decide that. If you have significant chronic fecal incontinence symptoms and you've tried lifestyle changes and oral medications, and these treatments haven't given you the relief you want, or you may not even be there yet. You may have just been unfortunately suffering in silence and living life. We can even start from the beginning. With my practice, we have a dedicated nursing navigation system that can help you in that initial journey to kind of start with the bowels, start discussing some of the dietary modifications and changes that we can go through to kind of help get you primed and ready through these various steps to understand what might be beneficial for you. So, we're asking you to trust a proven therapy. 89% of people using the Medtronic bowel control therapy have experienced long-term success, not perfection, success. And what are we looking for? Again, significant quality of life improvement. So your lifestyle, get rid of the embarrassment, go on those trips, go to work, not spend a ton of money on new underwear, undergarments, padding, soap, tissue paper, all of that adds up. We totally get it and we totally understand. It is FDA approved for bowel control therapy since 2011, and it's actually been on the market for treatment of other incontinence symptoms, including the urine, well before that. So this is something that is tested and proven to be safe and effective. At this point, over the past 25 years, there's been over 450,000 implantable devices thus far. So here's some patient ambassador comments. InterStim therapy has given me freedom from searching for restrooms or worrying about embarrassing moments. And this is from Pat. So I'm going to pause there and let you all ask any questions in the chat. There's a poll that's coming up. You'll be able to answer a few questions. You'll be able to leave some feedback if you're interested in being seen by my practice at the Colorectal Wellness Center. Put a special notation in there if you haven't even started any type of evaluation journey, if you're interested in getting a special contact from our nursing navigation system that can help again walk you through this process as we're kind of trying to understand what your symptoms are, understanding if you're a candidate for further advanced treatment or care. So I'm going to open up the floor to questions, and one of the trustee team members are going to call those out as they come through. Oh, I'm
Thank
going
you,
to leave
Dr.
this on so you guys can
King-Mullins.
scan.
Yes, I just want to
Yeah.
remind everyone that we have a poll up. If you want to be contacted to make an appointment, please select that. We will make sure that you get contacted to make an appointment and discuss your treatment options. I do have one question. related to insurance. Just wondering if the InterStim device is covered by insurance.
Yes, it is covered. Obviously, it's going to be, dependent upon your specific plan and your deductible, and out of pocket and all of those fancy things. But the reason why it's so important to do that bowel diary and start those conservative therapies, get that kind of navigation system going so we can document, because we do have to document certain things to ensure you're a candidate. We have to rule out certain other causes to make sure you're a good candidate. But yes, once certain parameters have been met, then we go through the process of submitting, and that helps benefit the need for, benefit the prior authorization process to get it approved.
We have a question related to, is the stimulation with InterStim comfortable?
So there are different settings, and based upon your settings, like if you turn it up a little bit too high of a frequency, it's too strong, you may start feeling vibrations, you may feel the activity. And so again, we want to make sure we have things on the lowest setting that's necessary to achieve your goals. Right. Well, thanks so much for all your questions. If we don't have any more in the chat, I'll just reiterate again, 1 in 12 US adults are suffering from this. You don't have to suffer in silence. So please reach out if you have any questions or concerns, if you want to start this navigation pathway. Um, and there's an extra bonus, one of the things that I do find, because again, this can affect all ages, male, female. I've seen patients in their 30s that have suffered from this for various other reasons. Um, and so that pelvic floor can be very complex, changes that have happened after surgery. And sometimes additional things are required to help get you over the hump, especially when we talk about some of the other functional um, concerns or hygiene concerns, when we talk about tags and excess skin and scarring and things that can happen from prior surgeries. Because sometimes leakage and staining and cleanliness can be related to the incontinence, but then sometimes it requires an extra, what we call is tushy touch up, to get you over the hump, because there's a certain level of cleanliness that may be involved with just getting rid of some of the skin tags and cleaning up scar tissue that may be in the area. So I'm here to treat all of it. And so if you
Yeah.
have any specific questions or concerns about that as well, please drop that in the chat or leave that in the comments when you're filling out the poll, or be sure to bring that up on your
Dr.
follow-up. And
King-Mullins,
my,
we got another
yeah,
one. It
okay,
said,
go ahead.
will the Medtronic InterStim therapy stop bowel leaking after a hemorrhoidectomy? Hemorrhoidectomy?
Sure, it could potentially. So again, that initial part of the evaluation is we have to kind of get down to the root cause of the lack of control to understand, exactly what therapy. But yes, there are circumstances where post-surgically this could be beneficial as well. And there's other opportunities, again, if you need a little bit extra push when we're talking about potential dietary changes, because there's only a certain level of perfection you can get to if someone's having diarrhea all the time and they need to have dietary changes. And so we also have a registered dietitian in my practice that is available for consultations. She'll go over your medical history, your surgical history, the current medications you're on, your current symptoms, and really try to tailor a plan with you, because sometimes you need fiber. But what type of fiber? Insoluble fiber, soluble fiber? How do you combine certain things that you're eating with certain medications that you're taking? So there's so many things that go into all of this. And so we want to make sure we take care of you all holistically, but also giving you back your quality of life. All right. Any other questions? All right. Well, thank you so much. I really appreciate you taking a few moments out to listen to me this evening. Reach out if you have any additional questions or concerns. Bye for now.
Perfect. Thank you, Dr. King-Mullins, and thank you all for joining us. We appreciate your time. And again, this was recorded and we will be sending that out, and make sure to contact her office if you want to book an appointment, and we'll follow up with you if you requested one. Thanks all. Good evening.